Hi, do you get pain in your back when you're sleeping at night and you're a side sleeper? If so, this video may be for you. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over stretch lying on your side, which is a position that you can get in lying on your side at night to sleep if you are a side sleeper, and that is the most comfortable position for you to sleep in. Before I begin, I want to speak a word of life from Psalm 127:2. In vain you rise early and stay up late, toiling for food to eat, for he grants sleep to those he loves. Side sleeping is a common position to get in, and if you've got low back pain, it can be difficult to stay asleep, and you can find yourself tossing and turning and trying to find a good position to get into. So stretch lying on your side is a way that you can lie to decompress the back as best as possible. And you want to keep your spine decompressed and in a neutral position with as much and as little stress as possible in order to sleep comfortably. And sleep is so important because that is when the body is going to heal. So sleeping uninterrupted is important. So what you want to do is make sure that you have a few pillows around. So you've got multiple pillows on your bed that you can grab to use for positioning your body. What you want to do is just go ahead and lie onto your side like you would normally lie. And the first thing you want to do is you want to lift your hips slightly up and then tilt your hips slightly forward. So you're just going to lift your hips enough to get an anteversion tilt in the pelvis. And you don't want to overarch your back, but you want to untuck your tailbone like you're trying to just tilt your hips slightly forward. If you've got like a bucket and you're picturing that tilt, just slowly pouring that bucket, that's the tilt that you're going to get in your pelvis. So I'm going to start with that anterior tilt. Then I'm going to push my body up, and I'm going to use my elbow for leverage to lengthen my spine. So I'm going to push my body up towards my head. So I'm kind of distracting the low back from the upper body. And I just want to lengthen the back that way and then lie back down. And then I'm going to further use my hand to lengthen my spine. So I want to use my arms to push my lower body away from the upper body, and it should feel good to the back as if you're lengthening the back there. And then you want to go back and do a check in your low back. If you're rounded, then you're going to want to lift up and reposition your hips so you've got slightly forward posture. But if you start to overarch your back, then you're going to also want to reposition your body. So I'm going to start from that again. I'm going to lift my hips slightly, tilt them forward, lift my body, get my stretch in my back, lengthening my back, lying back onto my side. Now I'm going to use a couple pillows to keep my head neutral. I don't want my head up. I don't want my head dropping down. I want to keep my spine as aligned as possible. So once I've got my body, my spine lengthened, my pelvis in a good position, and then I'm just going to do a body check here. And what I want to do with my legs, they're going to be in a zigzag position. I don't want them folded up, and I definitely don't want them crunched because then that's going to round my back. So the feet, the knees, and the hips are going to be at about a 120-degree angle in a zigzag formation. And then my neck is going to be neutral. I'll take my upper arm, just do a shoulder roll, pulling that down. And then I can even lengthen the back of my neck so that it's lengthening the upper part of the spine in this position. My arm, I can keep the arm resting to my side. I can let it come down and just relax here. If you've got a shoulder injury, sometimes it feels good to support with a pillow. So if you've got your pillow close by, you can place that between your torso and you can unfold, fold, however it is comfortable. If there is a shoulder injury, usually resting between the torso and the shoulder. If you're just looking to support more, you can put the pillow in front here. My bottom arm, I can have out in front. I can bring it underneath my head under the pillow here, or even sometimes folks will sleep with the arm behind their body if that is comfortable to you. And that actually can be a strain counter strain position for a particular muscle in the shoulder. So I'm not a big fan of sleeping with the shoulder or the arm behind you, but sometimes it actually can be relieving, and you want to get in the most comfortable position as possible. With the legs, you can also, when you're lying onto your side, if you want to straighten one leg and bring the other one in front, sometimes you'll find that's a comfortable position, but bringing that knee down kind of twists the back to keep it neutral. You just want to stack it on a few pillows, and you could even add another one. So that's just going to be how you could position the legs. But other than that, you can want to keep them about at a 120-degree angle in a zigzag position with a little bit of tilt forward in the pelvis, and then using your arms to lengthen the back and then lying comfortably. So when you close your eyes, you can do a body check, see if you have any tension anywhere, and see if you can play with that by either lengthening the spine or tilting your pelvis to reduce the tension that you're feeling. And once you're in that comfortable position, that's where you can take some deep breaths and slowly get into your sleep. So that is a demonstration of stretch lying on your side. It's to keep the back healthy while you're sleeping, and you want to stay asleep uninterrupted so that you can heal and improve the quality of your next day. I hope this is of help, and have a restful evening and a blessed day. Thank you.